Hi all and welcome back to Who Cares podcast, and today I'm joined by some fantastic guests and we're here to talk about the Dorset Hydration Project. So I'm going to hand you over because I don't want to really say that I know anything about this, I'm just getting dragged in. So let's pass you over. Do you want to introduce yourselves?
Yes, thank you. Hi, I'm Tina. I'm the Infection Prevention and Control Lead for NHS Dorset ICB.
And I'm Beverly. I'm the Regional Manager of What's in Care Homes, and I've worked with Tina on this hydration project.
And I'm Charm, really happy to be here. I'm one of the consultants working for the health protection team at UKHSA Security Agency.
Now, so it's Charm's fault that this is all happening. She's been bombarding all of us with numerous emails to get this to come together because it is really important, isn't it? This is such an important conversation. So who's going to kick it off? Who's got the first question?
So I've got a question. So, as John said, the reason we're here is I'm gearing up for World Antimicrobial Awareness Week, and that's why we're all here. And I just wanted to ask Tina, how is what's hydration got to do with antimicrobial resistance?
Thank you, and I think that's a really interesting question because very often when we talk about the hydration and antimicrobial resistance, particularly in a care home, it might not be so obvious at first. But actually, I cannot stress the importance between the hydration and the antimicrobial resistance, particularly when we talk about urinary tract infections amongst the older people. And I'll say it in a nutshell first, and then I'll break it down. Dehydration leads to many infections, such as urinary tract infections. Urinary tract infections then need to be treated with antibiotics. Many antibiotics which may be overprescribed, they can lead to antimicrobial resistance. And again, antimicrobial resistance, infections are harder to treat, and obviously that has got a significant health risk. So when I actually break it down and unpack it a little bit, the evidence is very clear that as we get older, and particularly if you're over 65, there are so many different risk factors that can lead to dehydration. One of the risk factors, for example, cognitive impairment. So residents may actually forget to have a drink, and that can lead to dehydration. But also, did you know that when we get older, our thirst reflexes reduces, which means that you no longer feel thirsty as you did before?
I had no idea about that.
I had no idea about that.
That is fascinating.
But there's also a massive fear factor that stops people drinking. So if they've had a fall or they feel a bit uneasy on their legs, they're like, I won't drink so much and then I won't need to go to the toilet. Or the fear of having an accident if they've been slightly incontinent. None of us want to be incontinent, so there's that fear as well that I won't drink, so then I won't need to go to the toilet. So that stops.
It's a really hard balance, isn't it? Because if you really are dehydrated, your cognitive impairment can really kick in, can't it? You can feel a little bit dizzy, you can feel even more wobbly on your legs.
Yeah.
I mean, what is the right amount of fluid to drink? I mean, you hear lots of things, 1 litre, 2 litres, 3 litres. I mean, what would you say? Or is it dependent on...
So the recommended NICE guidance is about 6 to 8 glasses of fluids a day, which is approximately 2 litres a day. So let me pose the question to all of you. The recommended guidance is 2 litres, and let's say it's a midday, which means that by now you should have been drinking at least 1 litre of fluid. And can you honestly say that you were able to drink that much of fluid in a day?
Not today.
We've had a coffee, didn't we?
Yeah. I think I probably had 3 cups of hot drink, whatever that works out to be. But that is crazy, isn't it? Because you don't really consider, I think that's the risk here, isn't it?
Absolutely.
That you're just not considering it. And I'm not particularly thirsty now. I haven't really drunk a lot, but I'm not feeling thirsty.
And you look to me well and healthy, and you can easily stand up and make yourself a drink of your choice, or you can have some nice fruit that are high concentration in water. But when we talk about our residents, they haven't got ability just to stand up and make themselves a drink. And I think, for us as a healthcare professionals, we have to be there for them to give them that extra support to stay hydrated, because very often, and Beverly will reiterate that, they cannot do that for themselves.
No, quite.
And honestly, we thought we were good. We thought both our care homes that we were good at hydration and nutrition. until we started this programme. And then all of us, and it was instant, we're like, oh my God, we just...
So tell me about this programme. So you've been doing it in your care homes. How did it start, and where are you now then? What's the difference been?
Well, it started with Tina. She has to take all the credit for this one.
No, I don't.
So Tina had the idea, first of all, but she wanted other people on board to really show some good statistics at the end of it, to prove that it was worth doing. So I know Tina through the infection prevention control meetings that we attend. So I brought both of our care homes on board. Other care homes came on board as well, GP surgeries, numerous. Am I forgetting anyone?
No, we've had a quite...
Hospital wards?
Yeah, a lot of different professionals. It all started with the government actually publishing the 5-year national ambition plan for antimicrobial resistance, and that included, reducing the infections, and it actually talked about the hydration for care homes. So we came up with a Dorset Hydration group, and we've had practice nurses, GPs, care home managers, continence nurses, dietetics.
True collaboration.
We did, but we were very conscious that we are healthcare professionals and subject matter experts, so really wanted to make it sure that it's based on co-design and co-production. So we actually went out and we've spoken to so many residents, care staff, their family of loved ones, and really wanted to have their perspective of what they wanted, what was needed, rather than coming it from the top down.
That's a really nice way of doing it, isn't it? Because you can really get a good oversight of
Absolutely.
what is the problem here. Because it's very easy to sit in your own little bubble saying, we think it's this. And quite often, as you know, as a registered manager, it's really not that. That's not the issue we have.
Yeah.
So I think it's a wonderful thing you've been doing. And have you seen great benefits for your
Huge.
residents?
Can I tell my story?
Please do so, please.
I have this story, and I tell it every time, and I've always got to be careful not to cry when I do it or make anybody else cry. So we have a lovely lady that has lived with us for about 8 years now, but her husband had done a fantastic job looking after her. So it's Bill and Pat. Bill has actually been out with us to do a speech as well. Where were we when he came with us?
Oh, it was a regional meeting to showcase the quality improvement project and
He
improvements.
came out and told his own story. He loved it. He really struggled emotionally with Pat coming into us because he'd been her sole carer for so long. But we worked with him and he became part of our family. Pat is a non-responsive now. She's unable to talk or walk through her dementia. She has very advanced dementia. And he always said, the thing he missed the most was her being able to talk because they'd have such lovely conversations. And we introduced the hydration programme into the home and got everyone involved, all of our families. And he said it was really great for him. So we have a hydration trolley that goes round as well as our normal drinks. But on there, we've put residents' choices. Somebody wanted a Coke float because that's what they remembered. So we have a Coke float, yeah. And different smoothies, individual blenders, so they can make their own smoothies. But what it also is a really nice activity for people. Sometimes when people are living with advanced dementia, it's really hard to connect with them on a visit. And people do feel they need to stay for an hour or two. Really, the optimal time for a visit to somebody living with advanced dementia is probably 20 minutes. But so Bill felt that he could really get involved. So he'd come and get a tray from the kitchen with all different milks and fruits and one of the individual smoothie makers, take it into Pat and give her whatever she wanted. And he'd make her all these different drinks and she'd love it. And in one of our homes, which is the same home, Adams Court, we've had no urine infections, I will add, for 2 years.
Wow.
None.
I mean, that's
None.
an incredible statement, isn't it?
And we've only had one in Osborne Lodge since we started the programme. So it's been huge. Sorry, back to Bill and Pat. So her fluids was increasing. Every day when he would leave, he would come to the office and go, Pat's had this amount of meals or this amount of cups. And him himself, he also realised he needed to drink more. He had a few health issues. And Pat started to say the odd word. And then every Friday he brings her fresh flowers and he cuts the flowers. And he turned round. He always talks to Pat and said, oh, Pat, I've made a right mess here on the floor. He said, I'll have to pick them up or I'll be in trouble. And she turned around and said, yes, she bloody will be in trouble. You better pick them up.
Love them.
And he just stopped and he was like, it was the first sentence she'd said in years. She doesn't talk all of the time, but what she does now is have the odd day where she's much more vocal. And he said to me, he said, I never thought I would hear her talk again. This is what gets me every time.
Oh.
It's that sentence. He said, and now she can talk to me and I can hear her voice. And it was just so moving, so revealing, and just so wonderful that it has just spurred me and Tina on.
Well, I think it's an incredible story, isn't it? So between the hydration and the interaction, this wonderful moment's happened.
Yeah.
And it's continuing.
Yeah.
I mean, that's something to behold, isn't it? What a real accolade to this project.
Exactly. And he says now she'll have the odd day where she doesn't talk so much and then another day where she will. So now he says, if I'm not in on any given day and Pat's having a chatty day, call me. Yeah. And I'll come straight in so I can chat to her. So that's what we do. And it's been phenomenal. And we had another chap come with us because he'd really self-neglected at home. And through fear of drinking, through fear of falling, he went into hospital. He'd been in hospital for quite a long time. And all he wanted to do was go home. He said, I'm not ready to be in a care home. I just want to go home. So we sat with him, explained the hydration programme, explained actually if you get fitter, if you eat better, if you drink more, then we'll help you. And that's what he did. Wonderful. You know, months later, he went home and he comes back now, comes to all our parties. He said one day he'll come back and live, but not right now.
He's got his Facebooks.
He managed to go home, and that was through the hydration programme. You know, he didn't realise he wasn't drinking through fear of needing to go to the toilet more and not being stable.
But you're probably finding, though, that through good hydration, they probably are stronger and able to get up and use the toilet themselves.
Absolutely.
Coupled with a bit of like sort of chair exercise or something to sort of start the movement again.
But as you said, cognitively as well.
Yeah.
So it's also helped with their sundowning behaviours and made them more social, more interactive with each other because they're more engaged, they're healthier. It's had... I think the staff saw such an impact so quickly. Our falls have reduced in both homes. As we say, the urine infections themselves. I think that's a real key thing here as well, isn't it? You know, the falls and the damage coming down by our fall is huge, isn't it? Yeah.
And the impact on the wider community of health and social care, isn't it? You know, with the ambulances and it's an ongoing thing, and that can all be mitigated by good hydration.
And it sounds so simple. And people go, yeah, but there is no but. That's it. It's good hydration.
So how long did it take before you started seeing real improvements, or was it almost instantly?
Almost instantly, with behaviours, people being more aware, more engaging, and also staff noticed as well. I've never seen so many water bottles stacked around the homes of all different colours and shapes and sizes. Because, you know, the care staff are there. They often do a 10, 12-hour shift. It's busy. It's really busy. And they were only drinking on a break.
Yeah. Well, I mean, I've worked in care homes and I was the same. And I worked up in Exeter Hospital as well. And you'll do a 12, 14-hour shift.
Don't drink
and
enough.
And you grab a small cup of water on the way past. Once every 3 or 4 hours, maybe, just because you're so busy.
Yeah.
But then you would feel tired and you'd feel lethargic.
Yeah.
And then we start having these conversations, you go, well, now I understand why, really.
But Bill himself, his doctor, he went to the doctor for a review. His diabetic numbers had come right down after his blood test. His blood pressure was better. He was feeling better. He'd lost some weight. You know, he was doing really well. And the doctor said to him, what are you doing? And he was like, I'm on the hydration programme. Do you want a leaflet?
Wonderful. And the GP's just like, excuse me?
But yeah, he's a great advocate for it. And the staff felt so very quickly.
Well, that's incredible, isn't it? That's incredible.
I just wonder what is it? So what does a care home that is doing the project look like? What's different between a care home that doesn't do it and does do it?
I think
what are the activities? How
so they
what
vary.
is it?
So
Yeah.
what we did, we started piloting back in 2023.
Yeah.
And we've started in several care homes, and they all obviously differ in sizes and the residents that they have. But what we did, we provided educational resources that we co-designed. Now, this was in a form of a leaflet that was specifically for the residents, leaflets for the staff, so they can actually educate themselves to make sure they're promoting the hydration. We had the banners, we had the posters, but we also created a hydration tabard, which people could wear when they're providing hydration drinks, also volunteers, families, with educational messages. But the beauty of that was they can actually come and create an innovation unheard of. So it would vary. So there is some of the care homes which really wanted to make it a social interaction. So they would make a fruit kebabs, they would make several games such as water ping pongs. They also, one of the care homes found that actually residents were drinking more when they were laughing. So I don't know whether you had a chance to look at a video. If you haven't, please have a look on our website.
So we'll put the link to that, shall we?
Yes,
Give me the
please.
link, and when we put this out, we'll put the link, because that sounds wonderful.
And what they did, they actually purchased and they dressed up in a blow-up cow costumes while singing and dancing, giving milkshakes to their residents. And I don't know how hot it must have been underneath those costumes, but it was just incredible. There was so much laughter, and all the residents were drinking all these milkshakes, and they were just having a laugh. And it's just, this was particularly for one care home that it worked. Other care homes were doing different themes. They were doing hydration themes, but it really adapting to what the care staff, because they are the ones who know their residents the most, to adapting what really worked. Because very often, and Beverly can say, it's breaking that routine from a resident just drinking a teas and coffee, because that's what they've been used to, but actually exploring and giving a wider variety of different fruit, vegetables, milkshakes, smoothies.
But it's recognising the importance of it. So our staff, when they do the hydration rounds, do wear the tabard, so it carries the same weight as a medication round.
Amazing.
If you've got the blue tabard on, you're not to be disturbed.
No,
So
I mean,
that's-
it's really, and that's a key thing, isn't it? It's so important. But I mean, I'm sort of sat here as somebody who's run care environments for many years, and all I can think of is, it's just a win all the way. For instance, so you've got the win for the people, the residents, the staff are enjoying it. But what you just explained then about dressing up and having fun, I mean, how great is that for your CQC report? How great is it for legislative bodies to come and go,
They
"Look,
love it.
we're
CQC love
fully,
it.
we're fully engaged with our residents to the extent we're not just sitting in a room kicking a ball around like the old days, we're actually really engaging. By default, they're getting more fluids, and by default of that, everyone's getting better off. I mean, that's really wonderful.
But it's even something simple, like Tina came up with this, how do you have your cuppa? It's like and I'm not being rude, you just made me a cup of tea and it's lovely, but I would never order a coffee from you because no one can make my coffee how I like it.
Well, that's just rude.
But nobody can. Not even, my daughter won't even make me a coffee. She's like, I'm not making your coffee, mother. But it's like care staff, they can have all the best will in the world, but they don't always have time. You'll say, do you have sugar or not, milk or not? And that's it. And then you get a drink, how you would make it yourself. It's actually taking the time. Do you like a builder's cup of tea, or do you like it really weak and milky? Or, it's even as simple as that. That's made a tremendous amount of difference.
It did.
Well, it's true. I mean, I've been given really strong tea in the past, and I really fancy the drink, but I wouldn't be drinking that. It's just not my flavour. So I think it's really relevant. It's being really conscious, isn't it, of your audience, and saying, do you want squash? Is water what you want? I mean, and having those real one-to-one conversations, but listening to what they're telling you.
Exactly.
Being creative and not being afraid to actually do something completely differently.
I really want to see that cow costume thing.
Yeah,
That's
so do I.
made me laugh.
It was good.
Yeah,
It
it's
was
great.
funny.
But it's really important to involve the families as well, because they can bring drinks with them. But they want to spend that time with their loved ones. So actually creating something that is a social interaction, making it together, makes a huge difference.
Yeah, I mean, one of my really good friends, he runs care homes in Devon, and recently they did a 1,000-mile walk for a charity where they got all the care homes to get everyone to walk 1,000 miles. I know it's not directly linked, but what was really interesting is, in a bit like this project, once they started doing their activities, the families wanted to come in more. So they might come in every once a week, but because they had this thing to do, they were in every day going, come on, let's just walk. And we had they had residents walking miles, and they didn't even think they could walk around the front room. But because they had some focus and some drive behind it, a bit like with this project, they're all really getting involved. And it was so lovely to see. I think sometimes you need catalysts, don't you, to make it work. And clearly what you guys have done is create this incredible movement in your care homes where everyone's now behind it. You've got your tabard on, don't distract me.
Yeah.
It's great.
Yeah, I think the message really is it's everyone's responsibility. And what we've seen, that hydration can be really an enjoyable experience, social experience, rather than seen as additional task. And it's really involving everyone. So, you know, we've had chefs coming out of the kitchen having the drinks with the residents, domestics that would stop and sit down and having that drink. And I think it's all about that enjoyable experience. You know, when you're having your drinks, it's not just drinking it, it's actually having a conversation, having a company. It makes all difference.
I think it sounds brilliant. And like you said, though, I mean, the fact that you're saving the use of antibiotics, that's really important, isn't it?
Absolutely. I mean, the message is very clear. Hydration reduces infections. Not having infections means you don't need to use the antibiotics. Less antibiotics lowers the risk of antimicrobial resistance. So it's a win-win.
And anybody that gets a urine infection knows it makes you feel very unwell. If an elderly person living with dementia gets a urine infection, it's off the scale.
It is.
Like, it makes them so poorly, so confused. So you almost need more care. You know, it's just...
And the risk of falls goes up.
Up.
Yeah.
Yeah,
Yeah.
up and
They
up
go
and
to
up.
hospital, don't they, with
Sometimes,
urine infections
yeah.
sometimes.
Yeah. And we have several people living with us with permanent catheters in place, and we're still on zero
No,
urine
that's
infections.
such an amazing thing you've
But
done.
also, what you've just said was a really valid point. We were talking this morning, you can almost drown in paperwork in the NHS and care homes, you know, sometimes that, and the management of them, you just can become very office-based. But you can't, because actually your main focus is always the residents. And I think what this did for our care homes was really brought the attention back to the residents. And actually the managers get out on the floor, make sure the hydration trolley is going round, join in the fun. And with the residents, the families coming in, being able to help them, it really, like you say, gave people a focus that puts the attention where it should be.
Yeah,
Always,
so.
you know, onto the residents. So for me, it's just been a win-win situation all around. And so many care homes are involved now, all experiencing the same results. I'm sure they've all got their Bill and Pat stories
I'm sure
at the
they
ready.
do.
We love Bill and Pat stories.
Bill and Pat, yeah, they're amazing.
Were there any challenges at all, Beverly, in terms of implementing it? Were there people who said, "Oh, waste of time"? Or you never know when you start something new. People
No,
they're not
staff
always
thought I was
positive.
just giving them more work to do.
That's true.
Yeah, all the staff are like, oh, something else to do, because they're busy, not because they don't want to do it. But as I said, they saw results so quickly, it kind of overshadowed that. And in themselves as well, they felt better. They were taking it on board. And you make it fun. I think that was the thing. The other challenge for us was actually getting our residents to drink.
Yeah.
No. I've had a cup of tea 6 hours ago. I don't need another one yet, because they thought they would be going to the toilet more. So it was just taking the time to get them to understand that they'll actually feel better if they drink more, and they won't need they'll be stronger, and if they need to go. So that was probably, and breaking out of the cup of tea or juice. That was the other thing. We really spent a lot of time with our activities coordinator talking about what they used to drink. It was how the Coke float came about. One chap just said, "Oh, I used to have a Coke float," and you know that was seen back in the day. He said it's a really Americanized thing, and he thought it was really cool to have had a Coke float. So we gave him a Coke float, and then other people were having a Coke float. It was actually a carer that came up with the idea of the individual blenders.
Right.
So cheap. They're like 12 quid off Amazon, and they're just a little battery operated blender. And we did have a member of staff going, health and safety, what if they put their fingers in? I'm like, nobody is going to put their finger in a battery operated blender. But they've been brilliant because family can just come and get one, take the milks and the fruits, like Tina said, with food as well, looking at the foods that have really high water content. Jello shots minus the alcohol is a bit of a favourite at one of our homes. So, and just staff having a bit of fun with it. Yeah.
Brilliant.
I think what's impressed me about this is, as you were saying, it's really co-produced. But you sat down with your coordinators and you really thought through, how are we going to tackle this? Because actually walking in and saying, John, you need to drink this, is not going to work.
No.
So you've had to think of a process to sit down with them and explain to them, keep that key messaging going through, because residents will then talk. If it doesn't match, it won't work. So, I mean, you've put so much energy in. But with the staff saying, oh, you're giving me more work, I would hazard to guess in the long term it's probably saved them work.
Exactly, and that's what they've said. You know, because our falls have reduced, because we've eliminated urine infections so far, touch wood, the residents are more engaged. You know, their day-night has got better, they're sleeping better. So, yeah, all around, you know, it has created less work from them, and they've all said they actually have more time now to spend with the residents.
Oh, brilliant.
So yeah,
That's the tagline. Less infections, less antibiotics, more time for care.
Absolutely.
That's the thing, isn't it?
yeah.
So what's next? Are you going to do more? I know you've won awards with this as well. So
We have.
Very, very.
Yes,
You
we've
kept
taken
that
it to
quiet,
the
ladies, didn't you?
next level, absolutely. Yeah, so I mean, oh gosh, this hydration project just brought so many opportunities. And yes, last year we have won the prestigious Nursing Times Awards. Judges absolutely loved it, and I think what really won it for us was that innovation, creativity, but also it was the integrated system working. So this project wasn't just in one care home, it was across the care homes throughout, across Dorset. We expanded to community hospitals, to primary care. So we really wanted to make sure that everyone has got the same opportunity. And to go even wider, so at the moment we're working with NHS England, we really want to make sure that we can scale it up across the southwest and wider. And we created our own hydration website that is hosted on Stay Well Dorset, and all of the videos, all of the infographics, the resources, everything is there for free to download.
Well, that's worth finding out about, isn't it? Again, another link we've got to find and put in here. They kept that really quiet. That's a bit sneaky, wasn't it?
Brilliant, isn't it?
Well, we also won the Dorset Care Awards for our part of the hydration programme. But we were saying this morning it was a true collaboration, and anything that gets NHS and care working together, because we were saying this morning we feel since COVID there's been a bit more of a divide where we all came together during COVID. We feel that slipping away again now. So we were saying this morning, what next? You know, this could go far. This collaboration definitely needs to be taken forward. You know, nothing bad can ever come from collaborative work between care and
you've got a shared vision, haven't you? You want to get people more healthy, get them more robust in their lives, and as a default, save the antibiotics, really.
No, absolutely. But I think overall, yes, we can, you know, reduce the infections, we can prevent the antimicrobial resistance. But at the end of the day, it's all about that patients and residents' outcome
Being better,
and experience
being
and having a better quality of life. That's what it comes down to.
Wonderful. Last words then. Should we leave the last words with you? What are your last thoughts?
This, like Beverly said, it's just a fantastic teamwork, isn't it? And I think we talked about it in the earlier podcast. Antimicrobial resistance is a big problem, and it's not something that can be dealt with by one person or even one organisation. It's across society and across different people coming up with different solutions, and that's exactly what you've done. It's beautiful. It's a thing of beauty.
Thank you.
Thank you.
Wonderful.
We're very
Thank you
proud.
very much indeed.